Swaziland, a small country bordered by Mozambique and South Africa, where 26% of the population aged between 15 and 49 is HIV positive. In 2007, Swaziland approached Médecins Sans Frontières to ask for help in the fight against HIV and tuberculosis. MSF started a project with the Ministry of Health in Xisselweni, one of the country's 4 regions, and since then have been working on tackling the dual epidemics. Tuberculosis is the biggest killer of people living with HIV/AIDS. The dual epidemic is threatening to wipe out entire generations, and fighting it is a complex challenge. By choosing to test and treat HIV-positive pregnant women, Médecins Sans Frontières reaches out to one of the most vulnerable groups of people living with HIV/AIDS. The objective is not only to keep these women healthy, but also to ensure that their children are not born with the virus. The ultimate goal of an HIV-free generation in Swaziland may no longer be an illusion, and this pilot project is a key juncture for the MSF mission in Swaziland. Girly is an expert patient. She's 45 years old and HIV positive. She made the decision to get screened on her own, and then had to tell her husband. Expert patients are HIV positive people who help other patients within their communities. Their tasks include visiting villages or isolated homes, raising awareness among patients, providing condoms, and giving people moral support. Among their many activities, expert patients continuously stress the need for HIV-positive people to talk to close friends and family about the disease. Kamfishani Clinic is a state-run clinic supported by MSF. It offers training for expert patients so that they can help provide care. The clinic used to be overwhelmed by its healthcare and administrative duties. Now, some medical tasks have been delegated from nurses to expert patients who work in the local communities. That reduces travel time for patients and means that they can be monitored more regularly. With the support of MSF, the health facility has gone from being a standard clinic to a clinic offering HIV and TB screening and direct treatment of those diseases.
I felt unwell just over a year ago. My chest and lungs hurt. I went to the clinic and felt better, but then felt sick again shortly after. I didn't know what to do and thought I had been cursed, so I went to see Girly, a traditional healer. He told me I had ailments he could not treat and said I should go to the hospital. I didn't want to go to the hospital, but Girly told an MSF expert patient who persuaded me. I found out I had HIV as well as TB and started treatment.
Today, by treating HIV patients with effective drugs and as part of a healthcare system adapted to their needs, their life expectancy can be similar to those who do not have the virus. Even better, the number of new infections may be drastically reduced by putting patients on treatment immediately after they're diagnosed HIV positive, and by creating synergies between the various preventative strategies, like the use of condoms, the prevention of mother-to-child transmission, and the National Male Circumcision Programme. Perhaps, eventually, an HIV-free generation in Swaziland is possible.